the heat in the wallet, all of that. There's that. Another thing is if you enter a pharmacy or a chemist shop or a supermarket and you find that where they stack the condoms, sunlight is always beating it up, please don't pick a condom from there. It should be in a cool, dark, you understand what I mean? A cool area, because the latex can be denatured with excessive temperatures. Okay? Yeah? Sorry? Mm-hmm. 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 So I'll say yes and no. Yes, if you just shaved. So if a lady is planning to have sexual intercourse, best not to shave that time. The reason is, like she said, one, the sharp edges can put micro tears in your barrier method. Two, you also have micro tears on your skin. So your risk of catching skin to skin, either a sexually transmitted infection. And remember that sexually transmitted is not just in the semen, can be from the skin as well, also puts you at risk. So that preparation you think you are doing just before the do may just be putting you in trouble. So you do it way ahead so that all of that is blunt hairs, all the micro tears are closed. Are you surprised? And not just the ladies, same with the guys. Some of you, that's what you've been doing. But now you know. Okay, one last one. Mm-hmm. Sorry? Rough days? Rough? Yeah, we already talked about that, right? Somebody said Rough Rider. Yeah, that's what you picked, right? So now, we said emergency. So we said one, there was defilement or forced sex or rape, a condom bust. So what else counts as an emergency? That's what brought us here. What else counts as an emergency? Sex emergency that led to unprotected sexual exposure. So I'm going to say another one. You take a daily pill and you forgot your pill for the day. Okay? We'll come to that. Your daily pill should be taken every day, whether or not you have sex. Don't say, oh, I'm not having sex today, so I won't use it. Some people use a daily pill as an emergency pill. Not true. Two different things. There's a way you can, but we won't go into that. The doses are way higher. So a daily pill is taken every day for continuous protection, whether or not you have sexual intercourse. So that when you have it, you're not worried because you already have that persistent level of hormone running right in your body. Yeah. Mm-hmm. Yes. Okay, no, so we'll come to that. It's 28 days, so there's an inactive pill for when you're in your period, so that you know when to start the active pill. But it doesn't have any hormone in it. We'll get there. Okay? So emergency pill is for sex emergencies. So you're having intercourse with your partner, condom broke, you pick an emergency pill. First, sexual exposure gives you a first chance to prevent pregnancy. It doesn't stop you from going to the hospital. Remember, there are other issues. There's STI, STDs. There are other things that you need to take care of. You want to say something? Mm-hmm. Yes. Mm-hmm. Okay, I'll come to that. Mm-hmm. 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 So unplanned sexual intercourse is what she's saying. You didn't plan to, although I believe we're responsible. There's something called responsible sex, right? That's an example of irresponsible sex. Yeah, because you go and have a one-night stand. Yes, you prevented pregnancy, but what about the STI, STD, HIV? What about that? right? That's one. But she's right, right? But you only took care of part of the problem. You're not taking care of the rest of the problem. So what we're talking about is about being responsible as well. And remember, we're talking about self-care. So self-care is not just preventing pregnancy, but you're ensuring a total sense of well-being, not just the absence of one particular part, maybe pregnancy or the likes. Do you get what I mean? So if you're going to go to a club and you think you may be having intercourse, don't say it's not planned. Better put a condom in your bag. This stranger, you don't know where he's from. You don't know where he's been. You don't know what he's sharing. So while you're being adventurous, if that's your thing, make sure you're taking care of yourself in every way, okay? But we'll come to the pros and cons of this. But you're right, unplanned sex, in a scenario where maybe there's a couple, for example, and the woman isn't on anything, because there's some people who don't want to take any method because they feel, my partner is not around and I'm not sleeping around, so I don't want something in my body when I'm not doing anything. And this partner comes for a surprise visit because maybe they moved him to town or he just wants to surprise her, and they have intercourse and she didn't plan to, but this is her partner. So what do? Preferably they use a condom, but what if they didn't? Maybe there was nothing. She didn't plan for it, there was no condom. At this time, she trusts this person, she knows his status, and then she wants to protect herself from unplanned pregnancy, then this will do. So let's come to that. So what is it? Like I said, it's a single pill, an emergency pill. It contains one female hormone, right? One female hormone, and it contains it in high doses, 1.5 milligrams. That's a lot. We'll come to that. That's a lot. And the reason it does that is because of how it works. So how does it work? It works by preventing ovulation. What did I say? I can't hear you. How does it work? So if you've already ovulated, what happens? Just chew on that a bit. So those who have turned it to daily pill, right? At some point, this girl or woman is going to ovulate. That means if you feel this is all you want to be taking, no, I like the emergency pill, I'm covered, and you're having sex. At some point during that month, you will ovulate. And then you use it, and you come back and say it failed. It didn't fail. It didn't fail. You just were using it after what it was supposed to stop has happened. So that is why it's an emergency pill, not an everyday pill. So if you are using an emergency pill more than 3 times in 1 month, though it's safe, some issues we'll talk about, but most likely it will fail because what you were trying to prevent would have happened at some point. So this is one of the reasons why you save this for emergencies, okay? So you have a window. If you have unprotected sex or a sex emergency happens, the earlier you use it, the better. So you should use it immediately you can. The first 24 hours is most effective, but you have up to 72 hours. But the longer you wait, the less effective it is, because the chances you may ovulate may increase. Someone may say, but I've been using it, even if I've ovulated, I use it and it works for me. There are people who are trying to get pregnant, actively having sex, trying to conceive. They've ovulated, they are checked, are heavier or they come a little later, which is a problem because now that it's coming a little later, you can't even say when is my safe period, when is not my safe period. You can't do those measurements anymore because it distorts everything. So keep it for emergencies, and that's what you should teach people. It gives you that first, or should I say first chance to prevent pregnancy. But at the end of the day, you should still see a healthcare provider, because when the healthcare provider asks you some questions about your circle, there are other things they can do to make sure that you don't get a surprise, especially if you may already be close to ovulation. I remember semen can stay in a woman's body for several days. So if you think, I'm okay, it will be waiting for that egg to come, or it will be there. You understand what I mean? So you need to make sure, again, on responsible sex, and it is safe to use with a condom because it doesn't protect you from STIs and STDs, including HIV. Now, this is the oral contraceptive pill, Lydia Fine. Okay? It's a daily pill. Contains 2 hormones. Post pill, that's the emergency pill. Our Lydia post pill has only 1 female hormone, right? This has 2. And look at the doses. You can see the same hormone in emergency pill. This one has 0.1 1.5 compared to the 1.5 the other one had. So that's such a lot of hormone to make sure that your body doesn't release an egg till the semen dies out of the body to prevent a woman from getting pregnant when she's not ready for it. So this is lower dose compared to that. It has 2 hormones. It has 21 active pills, right, which a woman takes every day, whether or not she's having intercourse. Whether or not. This also falls into the self-care category. To start, you need to talk to a healthcare provider. And one of the reasons you need to talk to the healthcare provider is because of that hormone, ethinyl estradiol. Can you see it? The one that is 0.03 milligrams. A female has 2 major hormones, right? Who knows them? Do you have a question? Yes, please ask. Yeah? This one or the other one? The first one, emergency pill? The emergency pill is a single dose pill, just 1 pill. So once you have that emergency, as soon as possible, because it works better the earlier you take it, even though you have a 72-hour window, you take that 1 pill and that's all. And that's it. And then we expect you to go to your healthcare provider for a proper check, right? Even if you feel you've ovulated already, you can still take it. But you need to follow up with something extra because remember, this is not going to work after ovulation. But it's better than doing nothing and then you go see your healthcare provider and they can do other things for you to protect getting an unplanned pregnancy. Again, remember it doesn't protect you from contracting an STI or STD, including HIV. Okay? For this one, it is once a day. There are 21 active pills. Our brand, you see 28 pills. 21 of them are active, and then there are 7 that are placebos. It's just empty pills. It's just sugar pills, okay? There are other brands that may have iron tablets for that 7. And like you asked, those inactive pills are what you take during your period. Some people don't take it. They just throw it away and then mark their calendar for the next 7 days, right? So this one, I said you talk to a healthcare provider before you start because of the estrogen. Now, remember I had a question. What are the 2 major hormones in a female? Yes, please. Estrogen and progesterone, right? Do men have estrogen? If you say yes, let me see your hand. Men, do men have estrogen? What's this? Do men have estrogen with your full chest? Yes, let me see. Okay, no, let me see. The rest of you, what? On the fence? You're not allowed to be on the fence. So if you didn't put up your hand, you're on a no side. Do women have testosterone? No, put your hand with your full chest. No? Yes, put your hand. We all have. Men have estrogen. Women have testosterone. But because it's not your major hormone, they're in minute doses. If a woman has too high testosterone, she's going to have ovulation issues. You're going to see her develop hair in funny places. You're going to see her extra muscular. You're going to see some very masculine traits. If a man has too much estrogen, you're going to see the boobs, you're going to see the butt. You see some men are very feminine, it's because they're having less testosterone and they're having, so when a man is the fatter you are, the more estrogen your body is going to start having as a man, right? People are pointing at people like, hey, that's my friend, I know. So we all have that, but the levels differ per sex. Now in a woman, right, progesterone is what is needed for pregnancy. It's a pregnancy-supporting hormone. And most of the hormonal contraception tricks your body into thinking it's pregnant. That's how it works. That's why the woman stops ovulating. That's why some of the symptoms that they feel, the nausea, poor libido, all of that, weight shift, which could be a weight gain or weight loss, is because the body thinks it's already pregnant. Okay, and that's why sometimes there are no periods as well. Right, so this has both. It has both estrogen and it has progesterone as well, but in low doses. And I'll tell you that's one of the benefits. So she asked how it is used. You use once a day. Pick a time at about the same time every day. If you want to use it every morning, maybe 10 a.m., use around 10 a.m. every morning, whether or not you're having sexual intercourse. And the reason is because it is not an emergency pill. The doses are low, 1. 2, because the doses are low, it doesn't store in your body. So you need a daily dose to maintain protection. Taking it only when you have intercourse will not protect you because it's too low. So that sustained concentration is what protects. You have a question? Go on. Okay. Just that period, 72 hours. Okay, so let's put it this way. If I have sexual intercourse today, right, and I use an emergency pill, if I have several times that day, which is not an emergency, you see people have problems, not an emergency, do I need to take more? No. What you have covers you just that day. If tomorrow, you see, those that have problems, tomorrow they have another emergency, they have to take another one. Yes. You can't say the one I used yesterday is still working in my body. You see why they have a problem? Because it's not an emergency. You can't have an emergency every day. Yeah. That one time is enough. So that's another. Do I want to go there? Okay, so it is positioned as a after-sex pill, which is the only after-sex pill. However, there are studies which were done mostly in West Africa and some other countries as a pre-sex pill. Okay, looking for the word when I remember, I'll tell you. And it works. That's the truth. But it has to be just before. But that takes it out of the docket of an emergency pill. So there are already conversations happening right now to position the emergency pill as more than an emergency pill, right? That women can take just before. So with time, in a few years, you're also going to see the same level of progesterone 1.5, which is positioned as not just an after pill, but as a regular method that a woman can take just before. Very important. It has to be just before, not days before. Just before sex. But at the moment, it is positioned as an emergency pill after sex. But there's nothing wrong with taking it before. But in this context, trust me, but in this context, it is just positioned as an emergency pill. Because if I don't want to go into the details, because you need to know how to use it properly to use it just before. Otherwise, people are going to get into trouble. That's one. Then 2, remember, it still is supposed to prevent ovulation. So if I've already ovulated, if I like, I should use it 1 second before. It's not going to work because what I'm trying to prevent has already happened. So it's all about knowing your circle, knowing when you've not ovulated. Once you've hit that ovulation, fertile period, the emergency pill is really not for you, except you just want to do something before you go to your healthcare provider for a proper intervention. Does that make sense to you? Yeah. What about them? All the pills we're talking about, they are simulations of the hormones your body makes. Later, she's been pregnant. It doesn't hurt the baby. Some people take an emergency pill thinking, let me take it so it will flush out the baby. It's not an efficient. You're deceiving yourself. The baby will even be going fatter because it's a pregnancy hormone. You're supplying, in fact, you're making the baby extra comfortable because it's a pregnancy hormone. It's levonorgestrel, right? So if you were even going to miscarry, that baby will say, thank you for your support. I'm good. Because what's the point of you continuing to take it? But remember, some of the hormones we give women who are trying to miscarry, they are the same hormones. but just that slight formulation differences, okay? So they do not, but there are other pills which are not in this category that do other things. There are other daily pills that help with skin, that help with removing abnormal hair with women, and all of that we will not give. If you find out you're pregnant, we'll say stop. Because if you're carrying a male child, it can make the male child effeminate, right? It can make the male child almost too girly, right? And then there are also other older pills that were removed. They had something like spironolactone, things like that, hyperteron acetate, some of those other, we won't give the woman who is pregnant, it can affect the baby. But all of these ones, even the longer acting ones, once you find out you're pregnant, stop. Answer her question. She wants to have emergencies consecutive. Yeah. Is that an emergency? Is it? Did you? Or it was an emergency? You're not convincing. Yeah. 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 Mm-hmm. So if you had sex in the morning, did you take any? Before coming here, did you take any emergency pill? We're talking, it's an example, right? No, don't worry, don't mind all these other people. I get you, I trust you. So you had sex in the morning, did you take an emergency pill? So if you take, as long as it's 24 hours, you don't need to take another emergency pill. One pill covers you for 24 hours. 24 hours.
Excuse me?
But if it's past 24 hours, please don't take. Because if you take 2 in one day, you took what? 3 milligrams. Why do that to yourself? That's too much. I'll come to you. That's too much. And again, like I told you, that is no more an emergency. You need this. Take this every day. Then you don't, if you like, have sex 100 times a day, you're covered. As long as you're having, if it's a pill, if you love pills so much, take this. Some of you are taking emergency pills every day. Come on, this is a daily pill. It's too much. It's too much hormone. Take this one.
Okay to take that.
But this one, you take it daily, whether or not you're having intercourse. I'll tell you the benefits of this in a bit. Yes.
So if you get sex once, you have to take that every day for 28 days.
Okay. Let me take your hers as well.
Take the following day.
You can or can't? Can't. You can become pregnant. Have you seen many jacuzzi babies? I've met a few. It doesn't matter. As long as it's penetrative, right? As long as the semen found its way into the vagina, up into the uterus, and fertilized an egg in the fallopian tube, you can get pregnant. The swimming pool, even though it has chlorine, is not a contraceptive and is not not an antispermicide, right? It isn't. It's not going to bounce back the sperm and say, now there's water. Fly. No. No. It doesn't. As long as it's penetrative sex, the risk of pregnancy is there. If you're doing other things and there's no penetration, maybe not, because you would dilute the whole thing outside that. Right? So use a condom. Yeah? Then her question, sex workers. Sex workers will use condoms more often than not. We'll come to that, the benefits, right? Because remember that STIs, STDs, including HIV, is a big concern for them. That's one. 2, a sex worker, if she's using an emergency pill every day, trust me, she's going to have menstrual issues. She won't be able to do her work. Remember I said it could delay periods, make it heavier, make it this. It's just going to mess up her menstrual cycle. It won't kill her, but it's going to spoil business for her. So most times when it comes to contraception, most of them will probably go for a longer acting method, something hidden. Not an IUD, but maybe an implant or maybe an injectable. Something that will not, because they probably don't want to take something daily except the woman really wants a pill. Then she can do this. Where at the same time every day she just swallows a pill the way she will swallow a multivitamin. Or the way she will eat her meal, she just takes it and forgets it. But she still needs to use a condom to protect herself. Right? And we'll come to that, about the benefits of condoms. For people who think, oh no, it makes the pleasure, it diminishes pleasure. Yeah, you're still in the year of Lord Lugard. Things have changed. Yes? Mm-hmm. 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 Which pills are we talking about? This ones? Yeah. Yeah. That's why I mentioned see, this pre-exposure prophylaxis that you guys are talking about, as though it's just something to swallow and you go to bed. If you have friends who are in the healthcare system, ask them. It's not easy. It's not, so we're not talking about PrEP. Now imagine someone who is having several customers every day. You think she's going to be using PrEP forever. She won't do business because she'll be sick a lot. They do have some serious side effects. But in spite of the side effects, you know this is to save my life, so you tolerate it, right? Whether it's PrEP, whether it's PEP, that's the pre-exposure prophylaxis or the post-exposure prophylaxis, right? So it's not something for couples who we call discordance, like one partner is HIV positive, the other is negative, but they want to have kids. Sometimes they have to take that. That's what it was really positioned for. Because now they have to take out the barrier so that they can have skin to skin to get pregnant. So you need to protect one. But it comes with a side effect. So a sex worker that wants to keep taking PrEP with every customer. What kind of business model is that? Like, so to protect herself from her customers and protect her customers from her when it comes to preventing contracting STIs, STDs, including HIV, that's where condoms come in. Whether she wants to use a female condom, which is unlikely, or she wants to use a male condom. To protect herself from getting pregnant, that's where contraception comes in, or pregnancy prevention. And it can be a pill, and it wants skin to skin. So if she's paying a lot of money for skin to skin, and she's not able to convince him that I have something that will make it even more pleasurable, and he says no, if he's paying a lot, then he can pay for an oral HIV self-test kit, right? If he agrees to test, but remember, if it's in the window period, she puts herself at risk for money. So she can take it and decide, oh, I will take PEP outside afterwards, right? And she can take PEP afterwards. But trust me, while she's taking the PEP, she will be out of business till she finishes. So that money must be enough to take care of her for a very long time. And remember, there's no 100%. So what is the take home here? You have a choice. This is self-care. And the most important person in the story is you. So if someone is offering you so much money in exchange for sex to put yourself at risk, it's your choice at the end of the day to weigh, do your cost-benefit analysis if you want to do this. But we're telling you what is best for you in this scenario. Business is business. So that's a risk. But if she should catch something, business will stop, right? Business will stop, and that money she will use to treat herself. Remember, PEP is good, but it's not 100%, right? So please, teach people the right thing. The fact that you have an option does not mean that option should be abused, and does not mean that option will cover you 100%. Okay? But at the end of the day, the choice is yours. I'm here today to give you the information so that you can teach others, and then for yourself as well, so that you can make informed choices. Some people know the truth, right? But they still choose to do what they think is best for them, and that's your fundamental human right. But at the end of the day, also think of the consequence, pros and cons. And with your full chest, if things go bad, I was warned, I can deal with it, no problem. Deal with it. We're talking about this, right? Okay, great. Mm-hmm. Mm-hmm. Your partner doesn't go deep inside. Define deep inside. Because inside is inside. There's a method called head. Okay. So when you say head, do you mean oral sex? Or do you mean it only goes with the tip of the penis? Will there be ejaculation? Will there be secretion of some kind? Yes or no? Yes. So pregnancy can still happen, can still give you an STI, STD, including HIV. If he likes, let it be the tip. As long as there's some exchange of fluid, you're at risk. Right? Remember, that just covers pregnancy. Right? An emergency pill, this lady, is for emergencies. All the scenarios you've raised, there's not been one emergency. They've been planned. Mm-hmm. 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 He's been away, then he comes back unexpectedly, and then you have intercourse. Without a condom. Yeah. Yeah. So you can use an emergency pill. But remember, if he has an infection, you're at risk. That's just my take home. Pregnancy, you may be covered. So I'm going to be rushing now. Yeah. Pregnancy, you may be covered. Right? You may, if you've not ovulated. If you've ovulated, then the chances are higher that you may get pregnant. But for infections, no. So I'm going to rush now, because I don't have, so I'll take the questions, a few questions at the end of this. So just note your questions, because I only have 10 minutes. So what are the benefits of using this? Contraceptive benefits, protects you from unplanned pregnancy. Again, I said to start this, you need to talk to a healthcare provider first. Because of the estrogen, some people cannot use this. If you're over 35 years old and you smoke, you can't use this pill. If you have a history of uncontrolled hypertension, uncontrolled diabetes, you can't use this pill. If you're on some medications like antivirals, right, or medications like rifampicin that is used to also treat TB, you can't use this. Sorry? No, that's fine. You can't use it. So there are some people who cannot use this. If you have a history or family history of breast cancer, you can't use this. Just note your questions, I'll take them at the end. So there are people who can't use this, even though it's fantastic, which is why you have to talk to a healthcare provider first. No. If you're on ARVs, you need to talk to your healthcare provider first. The reason is because it can interact with this and reduce the efficacy of this. So you may not be as well protected as you should be. So that's that. But some benefits you get, apart from pregnancy prevention, women who take this pill have clearer skin. It takes care of hormonal acne. It makes the skin brighter, clearer. Women who have painful periods, it makes the period less painful, pain-free. Women who have heavier periods, they have lighter periods with this. Women who have irregular periods, their periods become exactly 28 days standard with this. It's amazing. But it's not for everybody. So your emergency pill that you're swallowing every day does not do all of that for you. It's your heavy-duty pill for emergencies. This is your standard feminine pill to protect you and also do some not nice things. So moving along. Yeah, but you talk to your healthcare provider, and the take home is you use every day whether or not you're having sexual intercourse. So these are some of the benefits we mentioned. You can see them listed there. And it's also protective. If there's a family history of some kind of cancers, ovarian cancer, endometrial cancer, women with endometriosis, women with at risk of endometrial cancer as well, it is protective. Right? So you guys are sleeping on a very great pill. You do not know that. So IUDs, very quickly, these are long-term. You don't need to do anything every day. You fix it and you forget it for 3 to 10 years. You can remove it at any time. It has no hormones, so women who cannot or do not want to use anything hormonal because of whatever reason, this is fantastic, right? And there's a special kind of IUD for women who have never been pregnant. It is specially made for females who have never been pregnant. So it's very different from your copper T. It is called the Slick IUD, very flexible, very small. But you need a healthcare provider. Like I said, this doesn't fall into the self-care category because you need a healthcare provider to put it in. But the way it also falls in, because after it's put in, there are things you need to do to make sure it stays where it should be and you have no issues. But it can be there. This you can have for up to 5 years. So you put it for 5 years. All you need to think about is not pregnancy. Just think about preventing STI, STDs. One-time procedure and you're covered. And there are others that can cover you for 10 years if that's what you want. And you can remove it at any time. I can put it today and decide I want to take it out in a month's time, 2 months' time, 1 year's time. I don't have to wait till the end of 3 years, 5 years, or 10 years. So it's easily reversible, and immediately you remove it, you can get pregnant immediately. Same thing with the daily pill. Immediately you stop it, you can get pregnant immediately.
Yeah.
Okay. This is the implant, right? You can open and pass it on and just look. It's a 2-rod implant. It's for 3 years called level plant. Each rod is about the size of a matchstick. You can bring it out. And it's put into the upper inner part of your non-dominant arm. So if you are right-handed, it is put on the left hand. If you are left-handed, it's put in the inner upper part of your right arm. And it can be there for up to 3 years. This also just contains levonorgestrel, just like the emergency pill, right? But each rod has 75 milligrams. And once you fix it, it can stay there for up to 3 years. Okay? So it's very great, has its benefits. It's amazing. And it's great for young people as well. So the way we have this for young people, though we have other kinds, but this is particularly made for young people, that's the Slick IUD. Implants can also be taken by a young person. And many of the benefits that I mentioned, especially around women with endometriosis, women may have some kind of other feminine concerns, you have to talk to your healthcare provider. This can be beneficial. Now, there can be some side effects. Not everybody experiences them. But if you talk to your healthcare providers, all these side effects can be taken care of if they do happen. Okay. So these are, I won't go into details, but these are the care range. We have misoprostol, right? There are other uses for that I won't go into. You have a combi pack, which contains the misoprostol and mifepristone, and we have the MVA kits. So this, I don't know if it's within the scope of this class, but this also, especially the first two, fall under the self-care category because a lot of women have to make certain decisions about their bodies, if they're ready to have babies. There are certain things that they need to talk to a healthcare provider about, and with the guidance of the healthcare provider, it can be used for several indications depending on the woman's needs. Okay? I'm not going to go into all of that here. Condoms, so I'll close on this. Kiss condoms, we talked a lot about condoms, which is a good thing, but you can see we have several. Now, what do condoms do? One, condoms are the only method that do not just prevent pregnancy, they also protect you from STI, STDs, right? And they also actually increase sexual pleasure. So you must have heard people say condoms reduce sexual pleasure. They increase sexual pleasure. This is a new generation condom. Here you can see they come in different colors, textures, flavors. There's a reason for that. When it comes, and they are highly lubricated. So if it comes in different colors, they're depending on where you are. Some have it in black, some have it in pink, When you get those samples are for you, I'm not taking them away. So we can pass them around. Right? You know, you have them in different flavors, chocolate, strawberry, right? You have them in different textures, like this is studded. This is studded, so it increases sensations for both the man and the woman while having sexual intercourse, right? Okay, then this is the extra time. All those 2 seconds Indomie noodles people who cannot last more than a few seconds, this adds extra time for mutual satisfaction. So that narrative that people have, don't worry, it's here. That narrative that people have, that condoms will diminish pleasure, it's a no-no. That was those days. Now condoms enhance the atmosphere, excites the senses, actually increase pleasure for both. So that's another reason you should tell people to use condoms. So it's protecting you from STI, STDs, which is just very important. Can be also help you to increase the efficacy of your other family planning methods, because most of the methods we've talked about, the highest is about 98% effective. Add a condom in, and you can get closer to 100% preventing yourself from getting pregnant when you're not ready for it, right? And then you now also want to make the experience something unforgettable, then you have a condom, okay? So you have your classic, which is lubricated, nothing else. Chocolate, strawberry, studded. You have the passion fruit, for those of you who love the passion fruit scent. And then you have the Kiss Extra Time. We talked about injectables. So questions, I'm going to take 5 questions, and then we close. Have you learned something? Okay, great. 5. Yes, okay. Please listen. Please give her a mic if you can.
Yo. I have a question about the contraceptive pill.
Okay,
so
which of the
you're like,
contraceptive pills?
this pill should be taken every day.
That's the daily, oral daily. Yeah?
So if I choose to go that way and use the contraceptive pills, let me say I'm in an active relationship. So what do I have to have like a duration to first take it like 1 week consecutively before I'm sure that now it can actually work, or I have to take it like today and then the next day I go and then I have sex and then still I'm okay? So I just want to know. Then the second question is about the emergency pill. So take an instance, let me say I've had sex at 8 p.m. and I take the emergency pill at 10 p.m. So then after like 5 hours, let me say at 3 a.m., I again have sex. Is this emergency pill that I had before still effective, or do I have to take another one? Thank you.
Thank you. So, one at a time. So for the daily pill, you can start it at any time in your circle, right? Your day 1. So for example, if you start it in the first 5 days of your circle, like your period has started at around that period, you don't need a backup. It's fine. You're covered, right? Because you're not even fertile. You're not supposed to be fertile. Do you understand what I mean? You're covered. However, if you take it outside the first 5 days of your circle, which is after that period where we expect you're having a menstrual period, right? Then you will need a backup if you're getting pregnant for the next week. Do you get what I mean? So that's how you know. So if I'm starting within the first 5 days and I want to have sexual intercourse, I'm not worried about pregnancy. But if I'm going to have any time after that, I have to either, my partner uses a condom or something, or I abstain for the next week. After that week, then I'm still using my pill, then I can go on without worrying I'll get pregnant. The second question you asked, remind me? Yes. So like we said, what you take covers you for 24 hours. If you're going to have intercourse again after that 24 hours, you're going to need it again. And again, remember I said, if you find yourself using an emergency pill more than 3 times in 1 month, you need a regular method. There's no if or buts. Are you listening? There's no if or buts. Once you find that you need it more regularly, than 3 times a month, you need either a daily pill or consider any of the other ones, the IUD, implants, injectable, right? You need something else. And I keep stressing it. Pregnancy is one thing, but remember, STI, STDs, pregnancy, it will inconvenience you, it may not kill you. But an STI, STD, including HIV, can change your whole life. So don't forget to cover yourself for that as well. And it doesn't have to be boring. That condom you're using can even make the whole experience even more pleasurable while protecting yourself from that, right? So are you satisfied? You're satisfied? Okay.
Yes.
Second, yeah?
Madam, you said there's the conditions for not using the Lydia fine.
Yeah,
If you're
daily pill.
25 and you're smoking,
If you're over 35 and you smoke.
is it specific that if you're smoking tobacco or smoking anything?
Okay. Is that your only question? That's a question. Okay, so as long as you smoke, because smoking generally does something to your blood vessels. So there's a reason for that. The older you grow, your blood vessels are not as elastic as they should be, right? So that means that person most likely is tending towards heart disease or some kind of comorbidity. So if you're that and you also smoke, you're going to worsen that. And because of the estrogen, right? And that's why I said those who have some of the other chronic conditions I mentioned cannot use it. So if you're not a smoker and you're over 35 and there are no other contraindications, you can use it. Some women who are even in menopause and are having issues, sometimes they benefit. It has a whole lot of benefits, but we need to be sure that you will be safe or you will get the best results using this. So it doesn't matter what kind of smoking you're doing. You're smoking. That's what it is. If you like, if it's shisha, whatever it is, it's not for you. Yeah.
So my question here.
Yeah, okay.
I have two
So
questions.
I only have 2 slots left.
I have two questions.
Mm-hmm.
The first one, there are these couples that have a tendency of, okay, let's say these weekend marriages, Friday, Saturday, and Sunday. So they have a tendency of saying, let's have sex for 3 days, then on the last one, we take the emergency. Can it still work?
Okay, who wants to answer based on what you've learned today? Can it still work? Are you sure? What's the window for using the emergency contraceptive pill? 24 to
72 hours.
72 hours. But what's the caveat? Caveat 1. The earlier you use it, the better. Because the longer you wait, the less efficacious it can be. 2, if you ovulate before the 72 hours is over, you're on your own.
Okay.
Do you get what I mean? So yes, it could work. That's true. However, if you ovulate before the end of 72 hours, you take it. You may not get pregnant, but you may, because now what you're trying to use it to stop has happened. So the earlier, the better, honestly. The earlier. Don't wait and say, let's just do the whole 72 hours escapade. Then you swallow after. Remember, it's a female that is going to bear this. So do better. You can do better. Yeah?
So the second question is, do ladies that suffer from PCOS still use the emergency pill?
So women with PCOS,
Yes.
they can if, remember, you know what that means. So most times they have issues with ovulation,
Yes.
but it's better than nothing because they may not know when they actually ovulated. Except she doesn't mind. She may say, at least I have a baby, right? But if she doesn't want to get pregnant, like I said, it's better than nothing. If you have unprotected sex and you think the chances you'll get pregnant is there and you do not want to get pregnant, no matter where it is in your circle, still use it, but it will be best to still talk to a healthcare provider who can help you find out where you are in your circle if you don't know. If you find out you've already ovulated, they can put in an IUD just for a month or till your next period, and they take it out. That's a more effective emergency contraception.
So doesn't any contraceptive interfere with, okay, like you're already having issues with the hormones and everything, so can't they continue to mess you up?
Yes, it's an emergency. It's a one-time thing. Remember, it's a pregnancy hormone. So if she doesn't want to get pregnant and she's having sex, she should use a condom. If she's not going to use a condom and she doesn't want to get pregnant, she needs to use something, but not something she uses every time. Do you get what I mean? Yeah. I'll allow you. If you need more time, you have to ask the organizer.
So does it, okay, does it mean that I can use the daily pill for dysmenorrhea? Okay.
So if you have dysmenorrhea, not like you can use it for it, but the takeaway around the daily pill. Talk to your healthcare provider first, because there are those who cannot use it. So we need to find out if you can use it. Now, contraceptive benefits, it prevents pregnancy, right? And it's over 90% efficacious in doing that. Other benefits that are not related to contraceptives are what I listed. So if a woman already has heavy periods, she will enjoy that pill because her periods will be lighter, less painful, more regular. If you've been having hormonal acne, you find out your skin will be clearer. So those are some of the additional benefits that using. So contraception generally gives you, people talk about side effects, but there are side benefits to every method. So when I talk about the pills, side benefits for the daily pill is what we've mentioned. We talked about condoms. Side benefits include increasing pleasure, aiding lubrication, all of that. We talk about the IUDs, for example. You know, some of the side benefits are so many, apart from peace of mind, but some women who have difficulties even conceiving for certain reasons, it can help with that. Same thing with the implants, there are also side benefits to that. So these are some of the things that we should bear in mind and not just push side effects. Last question. Yeah. Okay, last one there. This is the story.
They got married after their wedding. So this couple did not want to have kids immediately.
Yeah.
So they opted for a family planning method,
What method?
which is the ultra urine device.
Intrauterine device, IUD.
Yeah, IUD.
Yeah.
And after the lady was done with the surgery,
Surgery?
yeah,
Procedure?
and they had inserted that thing.
Yeah, procedure.
Yeah, and the lady bled to death. So what could be
Sad.
what could be the side effects? What
So
would
was it
have led?
immediately after that she bled to death?
Yes, please.
Immediately after the procedure she bled?
No, like after 2 days she bled
Okay.
and the bride died.
Yeah.
Also, we are going to move out to communities as peer educators, and we are going to talk about the family planning methods. So, religion, for example, the Catholics, they
We know.
they don't.
They don't encourage family
They
planning
condemn.
except the natural one.
Yeah. And also, I've heard of, I don't know whether there are myths that when you use family planning, you don't go to heaven.
Is it in your Bible?
No, it's not in our Bible that it's the same as abortion, kind of. So what do you advise? What advice do you give to us as peer educators? What are we going to tell those people? Thank
Great,
you.
Great. Thank you. So the first one, from what you've described, most likely her uterus was perforated. And that's why it's important that when you're getting a procedure done, right? In this context, we're talking about family planning. Pink shirt. We're talking about family planning, right? You go to a trained and qualified healthcare provider. So if it is put in by someone who is not trained to do it and they perforate, meaning that it should sit in our uterus, but they've gone beyond the uterus and put it in our abdomen. So she could bleed. Imagine if they also punctured maybe her intestine or some other major vessel. She will bleed. The pain is going to be worse. Unfortunately, maybe, I can't blame her, but that's most likely what happened. The pain will be worse. She's going to be bleeding terribly, and she's going to have serious, non-resolving abdominal pain. It tells you something is wrong. And a scan will just show that instead of being right in the uterus, it's somewhere in the abdomen. Okay? So the most likely that's what happened to her. So it's not the method, right? It's just the incompetence of whoever put it in. So it's important that when you are counseling in the communities, you tell people to go to the right facilities. You point them to the right facilities. They may say they want to save money. Public facilities also can give that. But it's so important. Not someone that will say, no, in my house, I can do it for you. Bad idea. Same thing with implants. That's why people will say it moved. I put it here, it moved here. Does it have legs? Or I put it here, they say it moves around. It doesn't have legs. It's where they put it that it will stay. If it's put well, it stays there. And then at the end of when you're ready, somebody needs to bring it out. Do you get what I mean? Now, on the other side, of course, people have their religious doctrine, preferences, and we have to respect that. We have to respect it. However, your job is to give, you're the professional, give them what they need to do. I can tell you, yes, there are Catholics I know in some other places, and they start talking about it, or they turn a blind eye, because things are changing, right? Imagine a woman who has had 10 kids, almost died on the 10th child. Are you going to tell her to continue and die? So just give them the information, where they can go, all of that. If they have questions, to support you. You say, I don't believe in it, just give them. When she needs it or they need it, they know how to go. Same thing, people don't believe in blood transfusion, but when it's life and death, we know the discussions we have. So you can't push your beliefs. Yours is to give information so people make an informed choice, and when they do need, they know where to go and leave it at that. But you know, if you're a Christian, there's nowhere in the Bible that it says, if you have family planning, you will die. Or if you abort, you will die. I've never seen it. So everybody has their Where? Open it.
The story of this woman who got married to the brother.
Did he say abortion? He poured the semen to the ground. Come on, oh, you're in God, you're God's PA, right? He told you? He poured the semen on the ground, and it was about his mind. It was what he was planning to do, right? He was doing it to cheat his brother out of giving a seed for the inheritance. So that was what annoyed God, because his heart, God looks at the heart. So it's the intent that God looked at. Did you see abortion? If it's like that, all of you do withdrawal, should go to hell, right? Somebody here says yes. Don't judge those things with your own human senses. Take it the way it is, right? But your job is to give the information the way it is, because it is important. It is what we do is important. It is life-saving. Trust me. It is life-saving. We're not telling people not to have as many children as they want. They can. We're saying plan it, space it, give yourself enough time to recover. There's no point bringing children into the world that you cannot take care of when you're ready, right? Or having children and you die in the process. There's no point doing that. So have it, but just plan, space, enjoy your life while you're at it. That's all we're saying. And we're giving you the tools and the information to be able to do it. 1. 2, we're giving you the information to be able to bust the myths and misconceptions that are leading to barriers in the communities. And we're also giving you the tools to be able to point people and link them up to the right locations for the right services. What you're doing is so important. Nobody else is talking about it. So we're depending on you to be that source and that safe place that people can talk to come to, and where you can link them up with what they need, okay? Last question and we're done. Who was it? Yes.
Thank you so much. I just want to ask something small about the implants. Sometimes people say that if you insert that implant, and after you start maybe to eat certain food, you start to gain weight, and sometimes that implant can somehow damage your body. Is that true or no?
So when you say damage your body, in what way?
That sometimes you can check the body and you cannot do the implant there. So it's like absorbed into the body.
It has now become absorbing sutures. Okay, so the truth, like we just talked about, all the methods we talked about, they're modern contraceptive methods and they're reversible methods, all of them. So when people talk about it causes infertility, it causes this, it causes that, that's one of the reasons why you should go to a qualified healthcare provider who will talk to you, counsel you. We have the WHO eligibility criteria that will ask certain health questions to help decide what method, because it's individualistic. An implant may be fine for you, and may not be fine for the next person. So there are certain things that happen. Don't just say, I want implant, come, lie down, bring your hand. I say run away when you get that, because it happens. Oh, I came for an implant, my friend has, that's what you want. Enter that room, they bring implant. Walk away. That's not the place to be. There are questions to ask. We're going to check your vital signs. We're going to ask you certain questions, and then once we check your eligibility based on that, we can give you some options and say these are the options that you can take, these are the options you can take. Choose from this. Choose the one you want from the ones you can take. So there's that. Now, like I mentioned before, for every method, there are potential side effects and there are side benefits. And when it comes to side effects, it may happen, it may not. Every medication has potential side effects. Paracetamol, vitamin C, and some of you swallow those things without thinking twice. But if you read the leaflet, you probably will never touch it again in your life, right? But it doesn't mean you'll have it. So with the implants in particular, some of the potential side effects can come with weight shift. And it's not just weight gain, it can also be a weight loss. Some people lose weight on the implant, some people gain weight. And I always ask my patients, are you telling me that if I put an implant in your arm and I padlock your mouth so you can't eat, you'll just be growing fat? On what? On air? Is it possible? So it tells you that there's something about your lifestyle that is happening. And remember, I said these are pregnancy hormones. When some women, when they are pregnant, some add weight, some lose weight. So realistic, right? So that's what we say. You need to also watch your lifestyle. Have an active lifestyle, what you eat, what you know. The same way some women, we expect a woman in 9 months to gain about 10 to 12 kg maximum. But some gain so much more, they're unrecognizable afterwards. So if you find out that we've done everything sincerely and it's not helping, that's why it's reversible. You talk to your healthcare provider, they take it out, and it's a pick from the other method that you have, whatever it is. Some women may say, oh, my libido has reduced. I have women I have to give libido enhancers to, and that takes care of it. Once they start taking those libido supplements, they're cool, no issues with it. So, and remember, some of these things are also temporary because your body may need like a month or two to adjust, and then it just like the first 3 months sometimes in pregnancy is tricky, and then the woman is fine. So if you're properly counseled, you're told what to expect. When you're experiencing it, you work with your healthcare provider to ameliorate those symptoms. And if they become something you're not comfortable with, you're at liberty to ask for a change to something else. Okay? Does that answer your question? So it doesn't spoil your body in that if it's properly, I think I addressed that, if it's properly inserted, no matter the method, IUD implant, it stays where it is put in except somebody disturbs it. Okay? It doesn't move around. It has no arms, no wings, no legs. It stays where it is put, except somebody disturbs it and then is removed. So if you go to a wrong healthcare provider, trust me, it's horrible to remove, very important. So I want to believe there's a network of trained healthcare facilities you'll be working with. Try to always work with those healthcare providers. If you find out that the trained provider has left, let your coordinators know, because there's no point sending there's no trained provider, and they get butchered. And remember, if one person has a bad experience, trust me, bad news spreads faster. They're going to keep telling everybody for generations to come, family planning is bad. But family planning saves lives. Go do your research. It saves lives. It helps people to plan their home. It helps women to recover. It helps children to be born when the woman's body has, recovered enough to give the best resources to that child while in the womb. It does a lot. It does a lot. So we don't want people to use myths and misconceptions to, should I say, give it a bad rep. But we're doing all we're doing to let people know that this is a life-saving opportunity. And back to self-care, all the things we've talked about, whether they start off seeing a healthcare provider, but at some point they have to take ownership on ensuring that this works best for them, and also take accountability so that if they have issues, they feel free to go to you or the healthcare provider to say, this is what I'm experiencing, can I change it, what can I do? And then these people become advocates in their own communities. Does that make sense? Does that make sense? So have you learned something? I hope so. It's been a lot. We talked about a lot. Have you learned something? My only question is, what are you going to do differently around condoms? And I have my reason for asking about condoms, because a lot of people are getting comfortable using the emergency pill. We're seeing increase around people taking injectables, IUDs. For me personally, I'm amazed at how people, especially young people even, are embracing the IUDs. Fantastic. But the condom use is kind of static, and there are people who resist using it. What would you do to change that picture? Because that's the only way we can reduce the spread of HIV and other STIs, STDs. So what would you do as a peer educator to change, the perceptions or misconceptions around adding condoms to self-care in reproductive health? Not to replace the others, but as a standalone and as an addendum. I want 3 people to tell me, because it is important. Otherwise, you can't talk about sexual reproductive health or talk about pregnancy prevention without talking about STI, STD prevention. We'll be wasting our time. Okay? Thank you. You want to say something? Did you raise your hand? Yes, please. Go ahead.
Thank you. I think it's about sharing information, because most people are talking out of no information. For example, the usage, getting to know how it is put on, getting to know, because someone doesn't even know how it is put on, but yet is talking about its side effects. Then secondly, it's about giving information. Some of them think it's the one which causes the friction, and yet the friction comes maybe because of wrong wearing, wrong storage, and other things like that. So it's about information, taking the right information to people so that they are able to embrace the use. Thank you.
Here. For me, I believe that people's main issue is in terms of the experience they get while using the condoms. So if we could educate the public about the existence of such, like extra time, increased satisfaction, teaching them more about the joy that comes with, yes, basically. You get to tell them you get to prevent pregnancy, prevent STI, and you get better satisfaction. Then the use of condoms will go higher.
Yes, I don't think, I'm going to use it first because it starts with me, then the rest I will teach them. Yeah. You can't inform people about something which you don't use. So it's very good to tell people what you do. Thank you.
Okay.
Most of the times the reason why people get discouraged using these things is because of the myths that are surrounding them. I heard someone here saying, or asking a question that, is it that lubricant you use is cancerous or something? All those myths, I know that I'll tell them that they are not true and they are not there, and encourage them to use it, that a condom is 98% perfect.
Thank you so much for the opportunity. I want to thank the Reach a Hand Uganda group for inviting me. I hope you learned something, and I look forward to seeing you guys on the field and hearing about all you're doing towards advancing all we have for Uganda around sexual reproductive health. So thank you so much. God bless you.
A good afternoon to you all. At this moment, I would love to take the honors to thank our facilitator for having taken us through the different products of DKT, or is it? Yes, DKT, how the condoms, the better effects that come from the condom use. I personally had a bias about contraceptives because thinking that it could cause infertility. But from this education I've received today, I get to realize that they have no side effects. Eventually, when I take them off, I get to gain my fertility back. So I hope this has been impactful to all of you here, and I pray that not only should we leave it here, but God teach others and as well put it upon ourselves to also try them out and have a better planning for our lives.
Did I say they don't have side effects? They have, but does not mean everybody will experience them. But the take home is that they are temporary, right? And then if they become unbearable, you talk to the healthcare provider who can help you mitigate them or switch you to another suitable method for you. Take home.
Yes, so we have gotten the correction. So the side effects can actually be eliminated in the course of the journey. So at this juncture, so let's give her an abako. Abako, 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 kalawanda, kalawanda, facilitator. Yeah, it's better. Some of us had other programs already. Yeah, as long as you do something yourself.
Begin. He had big dreams ezokubera superstar nga MJ ngo bwalabo mukabira Facebook poster ebisawe nga bijula. It was all a dream nga Biggie bwe yagamba, but buli we yatuuka nga kazindalo nga crowd emwoganira vayo yayimba nga yekwese mizindalo anti ku stage bamukubanga zichokolo naye nga champion nalemerako. Giving up, teyakirowoozako. He worked hard, natuka ku radio, bwe yakola video, takyava na ku TV yo. Kati bwatuka ku stage nga bawugana, the same people bamugamba nga vayo. Bapromota mu kusooka nga basalawa, kati ekivulu bw'atakibaako tekijja kukwatayo.